What is the difference between Pterygium and Pinguecula? That's what we're going to talk about on today's EMN5. So you have a 26-year-old male. He comes into the ER for some eye redness and irritation after a day of surfing. And this is his exam. You see a lot of conjunctival injection. It looks pretty irritated. And then you notice this kind of growth, slightly fibrous looking on the nasal part of the eye here. So you know you have two options. It's either Pterygium or Pinguecula. Which is it? Good, so this is Pterygium, also known as surfer's eye. It's frequently confused with Pinguecula, which is why we're going to discuss the two here. So how is this inflammation different from the everyday conjunctival injection that we see? It seems to be kind of a growth that extends onto the cornea. It comes from the nasal side usually, and it's generally not circumferential, unlike this conjunctival injection that you see down here. So here are some more examples of pterygium. These are not quite as irritated. You can see that they're a little less red. A pterygium is a benign fibrovascular perforation of the conjunctiva and tends to be rather wedge-shaped. So you can see that here, kind of coming towards the pupil. It extends onto the cornea, so you can see it comes over the edge of the cornea right here. It tends to go from nasal to lateral side, and I'll explain why in a second. So you can see this is the nasal side in both cases of these pictures. It's pretty fibrous, tends to be kind of white or a little bit pinkish if it's injected. And symptoms can range from completely asymptomatic to a little red and irritated, or if you have a significant one, it can even cause vision changes. Risk factors tend to be sun and UV exposure, which means that people that live at lower latitudes are usually higher risk, and also younger males, 20 to 40-year-old. Now, like I said, it tends to be on the nasal side of the eye. One of the theories behind this, because of the UV exposure risks, is that the light actually bounces off the inside of the eye and makes the medial side of the eye, or the nasal side, have higher exposure rates to the UV light. Treatment is pretty simple. You can use saline drops for irritation or consider steroid drops, Pred Forte, for example, 1%. If it's significantly causing irritation or just for cosmesis, you can do surgical removal, especially if it extends enough that you're actually seeing vision changes. So you can always refer your patients to an ophthalmologist as an outpatient. Another huge thing in treatment is just prevention to begin with. Educate your patients about wearing sunglasses, especially if they're outside or exposed to high UV exposure. Alright, so what's the difference between Pterygium and Pinguecula? Here you have an example of each. So let's take a look at what a Pinguecula is. This is also a benign growth. This tends to be more of a breakdown of collagen, and the surface of the conjunctiva becomes more elastic. It does not extend over the cornea. That's the huge board question answer to what's the difference between Pterygium and Pinguecula. So you can see that it tends to be over on the side here, and it's not extending over the line of the cornea. It also tends to be a little more yellowish and raised, a little less fibrous looking. It too tends to be more on the nasal side, and again, risk factors are UV exposure and 20 to 40-year-old males. So that's the nice thing, it's about the same as Pterygium, except what I highlighted here in white. Now, Pinguecula can go up to the corneum, but it shouldn't cross. And here you see an example of that, and you can see a nice white line separation where the cornea starts. So how do you remember this? There's two P weird words. They both have to do with eye growths. One of them crosses the cornea, and one of them doesn't. The little kind of mnemonic for this is that Pterygium, with a T, crosses. So you can see crosses just like a T has a cross. And Pinguecula, which has an I, does not cross over. So that's how I remember it. So 3 to remember for this talk. Just remember both of these, Pterygium and Pinguecula, are benign conjunctival growths, likely caused by or increased by UV exposure. Pterygium crosses the cornea, remember with that T, and supportive care is mainly the treatment, eye drops, some Pred Forte, and referral to ophthalmology if it's really bothering the patient. Here's the references. Thanks for joining us on EMN5.